Hi all, today we'll take a look at clinical pharmacy part, which is teratogenic drugs and their effect on fetus. So we'll see the drug name and their effect on fetus. First of all, acitretin, methotrexate, both can cause multiple abnormalities with severe teratogenic side effects. Next one, androgens, virilization, limb, esophageal, cardiac effects on fetus. So, virilization means female develops male characteristics. Next one, progestins, virilization of female fetus. Again, it develops female characteristics. Next one, stilbestrol, vaginal carcinoma in teenage female offspring. Antithyroid drugs, fetal goiter, hypothyroidism. Cooking, it could cause congenital defects of heart, limbs and face, overall growth retardation on the fetus. Next one, diethylstilbestrol, reproductive system defects in male and females as well. Estrogen, Down syndrome, eye and ear abnormalities, and cardiovascular defects. Ethanol, fetal alcohol syndrome, HMG CoA inhibitors, vertebral abnormalities, tracheoesophageal fistula, anal atresia. Next one, isotretinoin. It could cause multiple abnormalities involving the CNS, cranium, face, cardiovascular system, and thymus gland. Misoprostol. So misoprostol is basically an abortion drug. It could cause abortifacient properties. Ribavirin, teratogenic, and embryotoxic. Next, sodium iodide, complete or partial destruction of thyroid gland. Thalidomide, severe teratogenicity with multiple birth defects. Vitamin A, severe teratogenic effects when given high doses for a prolonged period of time. ACE inhibitor,